Can the Centers for Medicare and Medicaid Services change state Medicaid programs? Breaking news for those following health care policies. The question many are asking today is whether the Centers for Medicare and Medicaid Services can change state Medicaid programs. With recent discussions around health care reform, this topic is more relevant than ever. If you are curious about how these changes could affect you or your loved ones, you are in the right place. The Centers for Medicare and Medicaid Services, often referred to as CMS, oversees Medicaid programs across the United States. Medicaid is a government program that provides health insurance to individuals with limited income and resources. While states have some flexibility in how they implement Medicaid, CMS holds the authority to approve or deny state plans and amendments. Recently, CMS has approved amendments for several states, including Utah, Michigan, North Carolina, Kansas, New York, and Ohio. These amendments involve changes to provider qualifications, medical education programs, personal care services, and adjustments in costs for certain health care services. This means that states are actively working with CMS to modify their programs to better serve their populations. In addition to approving state plans, CMS sets national standards and guidelines that all states must follow. For example, CMS requires states to implement community engagement requirements for certain Medicaid enrollees. They also mandate regular eligibility redeterminations to ensure that individuals still qualify for the program. However, it is important to note that while CMS can influence state Medicaid programs through its approval process and federal guidelines, the actual management and implementation of these programs are largely the responsibility of the states. States can manage their programs in various ways, including subcontracting to private health insurance companies or paying providers directly. In summary, while the Centers for Medicare and Medicaid Services can indeed change state Medicaid programs by approving amendments and setting guidelines, the execution of these changes falls to the individual states. As discussions around health care continue, staying informed about these developments is essential for understanding how they may impact access to health care services.